wonderful. Hi, it's Friday night, and it is really a beautiful Friday night here in Southern California where I'm based. And so, good evening to everybody. Magandang gabi sa inyong lahat. And if you're watching us in the Philippines, it is Saturday, 1 p.m. As always, I hope you had a wonderful lunch with your family, your loved ones, your significant others. And if you're watching us in different parts of the world, good morning, good afternoon, and good evening. Nako, this is an exciting day today. Nako, excited ako kasi our guest is one of the most wanted guests at finally nagkatagpo ang aming mga schedule. Nako, but before anything else, we are live on PHLB Radio Facebook page as well as live on PHLB YouTube channel. So if you're not a subscriber yet, what are you waiting for? All you have to do is click on like, share, and subscribe. And if you want to be notified of the show, you have to click on the notification bell so you would know every time we're on. Also, if you are using Amazon Fire TV, just look on PHLB Radio channel. And if you're using Alexa, just say, "Hello, Alexa, play PHLB Radio." Also, we are live on different podcasts, namely Apple Podcasts, Google Podcasts, iHeartRadio, and Spotify. And if you want to know more about the station, all you have to do is to click on www.phlbradio.com. And so, happy viewing to our team share at ang ating mga team replay. I can't say more than enough to thank you for sharing all our shows, or this particular show for that matter, and my other show as well. Magandang pabasko. Kumbaga, our numbers are going up. So, this is it na. Eto na, sabi nga nila, this is it, Pansit. This wonderful guest of ours is considered the best among the rest. Sabi nga, best of class. He is really the celebrity doctor of the stars, as well as really the bona fide cosmetic surgeon, and none other than our special guest for today. I'm so excited, I can't contain it. None other than Dr. Manny Calayan. Yes, Dr. Calayan, how are you? Say hello to everybody.
Hi everyone, to all the viewers there globally.
And luckily, the funny thing
nice
is,
to be with Josh.
what?
It's nice to be with Josh.
I know, and the funny thing is, for our viewers and our listeners, Dr. Calayan is really based in the Philippines, and we'll know more about that. It's just so happened he's in my part of the world. He's a little mini vacation because I follow him on Facebook, and you guys will be following him too because we're gonna give you all the social media platform where you could follow him. Pero marami tayong pag-uusapan ngayon kasi he so happened to be here in Los Angeles. So I took advantage of this situation that he's here. So we're doing this, and I am so excited because there's gonna be facts and myths about cosmetic surgery, some of the treatments, what are we supposed to do, and of course, a lot of you are going home or has not been in the Philippines and you are planning to go home, and of course, iba talaga paggawang surgery center or gawang Manny Calayan. Talagang makikita mo yung difference. I will give you some hints about that later. So, Doc Manny, how was your vacation so far?
Yeah, I've been here for about three weeks now. This will be my third week.
So is this something that you're doing now? Because I follow you on Facebook, and then most of the time you do little vacation now, unlike in the past. Is it because Bernie's a doctor now?
Yeah, because my second daughter is a doctor na, so she and her fiance are the ones managing the clinic na.
Kaya.
Yeah, kaya I have the time to...
Kasi remember, during the time that talagang I frequent Philippines, I always go to Dr. Calayan's office, Dr. Manny's office, and that's in Makati. Pero, at that time kasi, I met the three girls, yung ano mo, no? Di ba? Si Bernice, si Hannah, and there's another one.
Yeah. Hannah was here, siguro for, yesterday, she left for Canada na.
But Hannah is a doctor as well, di ba?
Hannah is an esthetician in Canada.
Oh, okay. So hindi siya sa clinic mo. Si Bernice
Hindi siya sa
nandito.
clinic, yeah. She do the facials in Canada, in Vancouver.
Oh, okay. What part of Canada?
Burnaby?
Okay. Hello,
Burnaby, that's
hello,
in
hello, Bernie.
Vancouver.
Okay, and then the youngest daughter.
The youngest daughter is in the Philippines. She's in studying medicine.
Oh my God. So, ang dati talaga
Still.
mag-inherit. Now, para clear lang, yung clinic mo, is still, do we still call it the Manny and Pai Calayan Clinic or is it the
Yes,
Surgery
yes. Oh,
Center? Kasi
yeah,
during my time, Surgery Center siya eh.
Calayan Surgery Center siya.
So,
Yeah.
to this day, okay, Surgery
Pero
Center pa
ngayon,
rin.
Manny and Pai Calayan Clinic pa rin.
Okay,
Yes.
para clear din, alam ko may mga branches ka na. Because before I go to your Makati office, and then
Mm-mm.
now, meron, tapos nabalitaan ko may Quezon City office ka rin. So, meron pa
Yeah,
bang ibang
oo.
offices?
Meron sa Alabang, that's in Festival Mall. Ayun, sa Makati, and yung Trinoma closed pa kasi post-pandemic, di pa namin na-open.
So, you have
Pero,
Makati, you have Quezon City,
yeah, Alabang.
and
Oo.
Alabang. So, tatlo.
Soon, kasi we have in Davao and Cebu before the
Yes, I know about
pandemic.
the Cebu. I saw the opening.
Yeah, because of the pandemic, we closed it down muna.
Doc Manny, where do you find the time?
Ay, wala. Ewan ko ba, Superman yata ako.
But I'm glad that you're doing kasi I know you're doing little vacation. I like what I said earlier. I see you really having a time of your life. You go to local places in the Philippines and then now of course you go to LA. So is this the new thing when ano to, parang bang new ano to, new leaf for you na pinasa na
No,
sa mga bata?
kasi aside from being a doctor, uh, I decided to be a vlogger also.
Yes, I know.
So in that way, nakakapasyal ako, and yung ibang lugar, would you believe, nung ko pa lang napuntahan yung mga oras na yun. So I enjoy being a vlogger and at the same time a doctor. Kaya
And
ito, nasa
you're
LA ako. Nasa LA ako for 3 weeks. Binlog ko kung ano-anong lugar dito. And, ayun, enjoy. Super
ang
enjoy.
sarap, 'di ba? Ang sarap kasi everything that you see is fresh for other people eh, 'di ba?
Yes,
So
yes,
mamaya
yes.
we'll talk about yung vlogs mo para ma-follow ka rin ng marami nating
Yes.
nanonood sa
Oo,
atin. Kasi I
yes,
know that it
yes.
will be an exciting field for them to understand also na you're not only
Right, right.
a cosmetic surgeon, but also definitely meron kang fun time to do your vlog, and of course I know you do sing pa because you people who've been following Dr. Kalan or you're not too familiar with his other side, he was the grand champion of duet. That was a GMA
11 do
network.
it.
Yeah, duets. Siya yung grand champion. And you could find that sa YouTube. Nandun po yung mga... it's a weekly competition and of course, he won it all. During
Yeah,
that time.
that was a long time ago. I think that was set 2007,
I know,
2008.
pero doon sa mga tao gusto makita, he has that other side. He's a performer, he's a singer. And sabi
Yes,
nga
yes.
niya, baka
And
Superman siya eh.
yeah, sabihin natin Josh sa kanila that we had a CD before.
Yeah, 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 yeah. Now, Doc, eto na, may
Yeah.
mga tanong dito, okay?
Mm.
Firstly, yung mga, ang dami dito kasi I mean, it's common naman dito sa North America, especially here sa US, marami mga derm clinic ngayon. And a lot of times, even people would call me to complain kasi nasusunog yung balat nila o yung masyadong matapang yung mga ano. And most of them, they're really not doctors. They're not like dermatologists. They are like, yung
They're just
esthetician.
entrepreneur.
Yes, pero hindi talaga
Entrepreneur.
sila medical doctor. What's your take on that? Ano po yung take nyo? Kasi talaga yung iba, and it's cheaper, parang to do facial and all that, may mga hydrofacial, pero they're really not bona fide doctor. They're not medical doctor, they're not even, well, they're not even dermatologists, and they call it esthetician eh.
Yeah, I have no against them naman eh. As long as kasi esthetician naman is part of beautification din. Pinag-aralan din naman nila yan. And I know may license din yan dito sa States for being an esthetician. So, being an esthetician and being a dermatologist is a different one. They are they are two different what do you call this profession.
Yes.
Oo.
Pero
Esthetician do more of the facials, the mga botox and everything. Well, the dermatologist can iba yun eh. Can do dermatopathologic diseases.
yeah, and then
Mm-mm.
some of the businesses that I know personally, there might be a esthetician, pero they have a doctor within their group that does the liposuction and then
Right, right. Oo, yan sila yung tinatawag na medical director
correct, correct.
of
And
the
para
of
pag
the
may
of the
nangyari doon
group.
sa pasyente, they'll be liable.
Yes.
Mhm.
Yes. Oo. Yeah.
Now, Doc, ang dami nga yung mga recent, we're gonna show some of the pictures that I'd like you for us to talk about, especially,
Sure.
okay, now, before we go that, so, nag-office ka pa rin ba sa mga clinics? Because I know a lot
Yeah.
of people would like to be specially personalized handled by Dr.
Yeah.
Manny Calayan. So, paano
Yeah,
yung schedule mo?
actually I'm here in the United States lang to may pinapagawa kasi kaming bahay ng kapatid ko for me. So, tinitingnan ko muna for 3 weeks yung construction. And then, pag uwi ko, syempre, ayun, nakapila na naman sila.
Well, the good thing is that you talk about that house. You guys will give you the blog of Dr. Kalayan, Dr. Manny, and it's funny because there was this blog na sinabi niya yung parang mga gumagawa babae sa niya. O yan ha, ang babae pa yan, ang bilis-bilis. I told you, I follow you.
Yeah, you must be, you must have seen that.
Kaya sabi niya, grabe, ang babae, ang bilis-bilis. O,
Ito,
ginagawa yung parang
matatapos na. Di ba?
Now, let me show you some pictures, okay? And what we're
Okay,
gonna do, I'll show you some pictures and you tell me kung ano yung before and after. And then tell me ano yung ginawa, what was the procedure about, okay? The first
sure.
one is this one.
Oh, yeah. That one is, itaas mo, Josh. Ayan, that lady, I had nose lift. I did her nose by using threads only.
Okay,
By
now, in the olden days, ginagawa kasi yung parang Gore-Tex, di ba? O kaya yung
Yeah, up to
sa
now
likod
naman,
ng...
Josh. Up to now naman. Up to now, it's their discretion kung anong gusto ng patient, kung gusto ng surgical or non-surgical or surgical.
Okay?
Pag gusto nila yung takot sila sa opera, I do the threads, the
Okay,
PCL
wala na
thread.
rin ba yung kinukuha yung vein sa ilalim
Meron
ng
pa rin
tenga?
yan. Meron pa rin yan. Oo.
So
Depende
which
talaga sa gusto ng pasyente.
now the thread, my understanding and correct me if I'm wrong, yung thread parang temporary lang yon, natutunaw yon, parang ganon, totoo ba?
Yeah, natutunaw yun pero it takes about 3 to 5 years then.
Ah, okay. Now which one does it depend on the patient or it depends on recommendation? Meron bang pwedeng hindi lagyan ng Gore-Tex, pwedeng hindi lagyan ng thread at you refer to
Yes. Upon assessment, first of all, siyempre pupunta ang patient sa'yo. Sabi niya, doctor, I want to have a nose job. Sabi ko, oh, what do you want? Do you want surgical? Do you want non-surgical? And then if they say na I want a lifetime one, and then we'll do the surgical thing. If they tell naman na gusto ko muna, tingnan muna ang itsura ko habang matangos ang ilong. So I'll do the thread thing.
okay, yung pag surgical either the Gore-Tex or yung sa vein sa likod ng tenga. Now, yan ba ay lifetime po yon?
Lifetime yun. As long as hindi nire-reject ng implant.
Okay, and when you say reject, ano yon? Magbubukol-bukol?
No. When you say reject, mamamaga, signs of rejections are swelling, redness, and may mga discharge na lumalabas.
Ah, okay. Now, this other one, so on the thread naman 3 to 5 years.
3 to 5 years.
Okay. Now, based on your experience,
I-advertise ko na yung sarili ko. This is thread.
you always have nice nose naman
Yeah, pero hindi mo napansin may nagbago because of
Yeah,
this
yung
one.
medyo medyo na-pronounce. Nasabi ko
Yes.
nga eh.
I did it myself.
Oh, what?
Yes.
Hindi
I
ba
did
siya
it
masakit?
during I did it during the pandemic. Sabi ko wala akong magawa, 'di ba? And then sabi ko teka, ma-trend ko nga itong ilong ko. Wala ako lang
Yan,
gumawa.
Doc Manny, ikaw nagsimula niyan kasi marami ako napansin dyan sa mukha na yan Pabata ng pabata.
Yes. Yeah, tama, wala akong wrinkles.
I know, I noticed that. Tapos parang
Wala
tumaas pa
akong
rin.
laugh line. 'Di
Yeah.
ba?
Okay, sige, ikaw
Yeah.
nagsimula niyan Sabi mo,
Sige
ikakat.
lang. Benta ko na sarili ko.
Yeah, might as well. So for that, for yung sa wrinkles mode is still that kasi dito ang alam ko either Botox or they call it Genuve. So sa Manila, what do you use? Is it still Botox?
Botox, fillers, and threads.
Nagte-thread din.
Thread din dito.
Oh,
Yeah.
wow. Is it painful? Ayan
No?
nagtatanong na tuloy ako.
My patients are all awake, and then the thread lift for the chicks, it takes around 10 minutes.
Oh my, and you do it yourself?
Yeah. I did it myself. Ganyan lang. Makasalamin lang ako. I gave you a picture. I gave you a picture of that.
Yes, isusunod-sunod natin yan para makita natin. Here's the other one. This one is very interesting kasi parang talagang makeover. This one.
Taas. Ayan. That is Gore-Tex Rhinoplasty.
Ito yung
Yan.
sample.
Yan. Yan yung implant ang nilagyan natin sa ilong niya.
Gore-Tex.
Gore-Tex.
Yeah.
With tip dito. With tip sa tenga.
Combination.
Combination. Kaya tumangos talaga.
Oo, tsaka nag-iba yung mukha niya talaga.
Tumanda siya.
Super, di ba? Okay, the next one, this one.
Taas mo, Josh. Ayan, taas pang konti. Yan, that's a lola that I did a non-surgical thread lift, cheek lift.
Oh, kaya na yung
Kaya
fold
nagka-cheek
niya.
siya.
Oo, tsaka yung fold ng mukha niya tumaas.
Yes, nawala.
And when you say that, it takes 3 to 5 years bago bumaba uli?
Yep.
Okay,
3
yung
to
po
5
thread na
years.
ginagamit, para clear lang. Yung thread na to, explain, hindi po yung, kasi alam mo naman minsan, di ba, pag sinabing thread, baka akala nila,
Sinulid
thread
lang.
na pangtahi. Di ba? Kasi di ba, remember some of the cases, yung mga silicone, people would think it's the petroleum jelly and we have a lot of cases.
Ay, nako, horror stories.
Di ba horror story? Now, paki-explain itong thread na to, this is not your normal thread, hindi to tali.
Hindi ito tali. This is composed of PDO threads or mga polydeoxycholic threads. These are nylon threads for human being. It is used to di ba, minsan tinatahi tayo sa loob.
Yes.
Halimbawa, tinatahi tayo sa loob ng tiyan, ganun. Those are the threads, yung mga threads na yan, pang tao na natutunaw in time.
So, but the gradual ang kanyang dissolve pag nagdi-dissolve.
Yes, and what's ang magkagandahan dito sa thread na ginagamit sa face, it stimulates the collagen synthesis. So habang andun siya, sinistimulate niya yung regenerate ng collagen. So nagkakalaman siya.
Kasi to my understanding, and again, collagen diminishes as we age, di ba? Kung konti.
Yes. That's right.
Now,
collagen depletes when we age.
Yeah. Now, about this one.
Ayan, that one naman is she's the wife of Eric Eruption. Eric Tai.
Okay. Yeah. Yung sa yung
si Rona. That's Rona.
Yeah, yung niya.
Tama yung double chin niya na wala. Look at
Ito,
this
thread
one. Thread din yan. Thread dito lang nilalagay. Para
Ah,
ma-thread, ma-chick, double, ano, what do you call this? Double chin lift.
so that's better than kay Bella.
Yes, oo. That's better
Okay.
and that's mas matagal.
I think we have that here. Is it
Oh.
how it's done?
Yeah, put it upper. Yan, that's how it's done. Uh-uh.
Okay, so ano tong mga pink na to? Parang masakit.
Hindi. Yan yung mga threads. Yan yung may needle yan. Yung pink na yan yung hawakan ng yung thread.
Oo.
May nakapasok na yung mga needle diyan.
Okay.
And then aalisin mo isa-isa yung pink na yan, may iwan yung thread.
Okay, now, pag pinasok yung pink na yan, naka-anesthesia ba yan? Is it local anesthesia?
No, parang ano yan parang acupuncture eh. Ang
Ah,
naka-anesthesia lang yung sites.
now, dahil parang
Three sites.
doon pinasok, would it create parang a mark? O walang
No,
mark siya?
no, because the needle is very, very thin.
Paano kung doc, kung ano siya, yung keloid siya, prone to keloid?
It's non-surgical, Josh. So, no, wala talagang downtime. Walang kitang. It's like a lunchtime procedure. When
Ha?
you do
Ganun
it and
lang?
then you go out of the clinic, wala lang.
And then the result is immediate?
Yeah, immediate. Tapos medyo mamamaga ng konti, mga 3 days. Tapos, ayun, makikita mo ni result habang tumatagal, gumaganda siya.
Ako, audience and our listeners, nako, baka pag uwi ako ng Pilipinas, pagbalik ko, iba na yung
Iba
tsura
na.
ko. Okay, what about this one? I think this is something.
Yan, that's the chick lift.
Okay, can
That,
you do it like sa jaw, tapos sa cheek, all at the same time? Pwede ba gano'n?
yes. Oh, yeah, meron tayong ginagawa dito, tapos at the same time dito. Yan. So para siyang manikang para siyang manikang ang tawag dito, kinulam.
Now, how safe is this though?
That's very safe as long as you are trained. There's a
Ah,
training for that It's not done by just that pinapanood mo lang. No. Kasi if you are not trained, may matamaan kang vessel or nerve, mapaparalyze ang face mo.
kasi I've seen one here na isang doctor's office. Wala silang ginagamit na parang yung pink na nilalagay mo. Parang mano-mano.
Ano yun, mano-mano?
Parang yung ano lang, basta parang tinatahi yung skin. Na nakakatakot.
Ewan, this one is Korean technique.
Yun ang Korean technique.
Korean technique.
Pero
And alam mo naman,
paano kung pag
Korean,
nanginginig yung kamay mo, paano na yun? Magkaiba, no? Magkaibang pasok.
ayun, dapat hindi ka talaga nanginginig.
And
Yes.
I've seen some people na ano sila, parang nasuntok muna for a while. So, feeling ko kasi parang kami na-hit na nerve.
Hindi, meron din akong patients na nagbe-bruise
Yeah.
sometimes. Yan is, ano sila, talagang mabilis magpasa or easy bruising sila.
Okay, when for example, nag-bruise, how long would that bruise stay?
A week? A
A
week.
week?
A
Okay,
week.
now, if, for example, if somebody would do it, sabi mo nga, lunchtime procedure.
Mm.
So, so they could go, wala na siyang, walang downtime, you said, and then what about yung mga diet? Kailangan ba no fish, walang malansa, or they cannot do any strenuous activities?
No. They can eat whatever they want. They can do whatever they want. Basta don't wash their face muna for about 24 hours.
Okay.
Yun lang. That is to close muna the pores, yung mga punctures.
Oo. At walang mark.
Yeah, walang mark. Walang mark.
Wow. Okay, now, let's see this one.
That is ano yan, butt augmentation. Buttocks. Pinalaki natin yung puwet.
Okay, pero saan galing yung hindi to silicone?
Ano, that's silicone. That is implant.
Implant.
Implant
Yan
yan.
kasi, let's face it, yung mga audience, I know, especially for Filipinas, common yan eh na maganda yung harap nila, yung the breast side, pero walang puwet. And that's always a
Yeah.
complaint. Even some of my good friends, sabi nila kailangan talaga may puwet. And of course, they
Yes.
could exercise. Sometimes genetics eh, hindi talaga lalaki yan eh.
Wala
Eh,
talaga. Oo, yeah,
oo.
yeah. Oo,
So,
wala talaga.
pag ganyan, kunyari, kasi I've heard also, and of course, you being the cosmetic surgeon, minsan daw taba ang ini-injection. Is that the same or which is one
Yeah,
is better?
I also do that. I also do that. But we call it BBL. That is Brazilian butt lift, which
Uh-huh.
is butt lifting by getting fats from your own fats, no?
Uh-huh.
From your chan and from your thighs. Pero kung payat naman ng pasyente mo, saan ka kukuha?
So,
Oh.
ito yung when you're doing liposuction, kasi narinig ko na yan sa some patient. I think sa ibang sa yata rin yun eh. Parang pag nagla-lipo, yung taba sa lipo, yun din nilalagay. Is that true?
Yes, oo. If you can see my Facebook, pinopost ko minsan yon, yung mga fats na nasa tube.
Yeah, nasa tube.
Yan, nililipat ko ngayon dun sa puwet.
Oo.
Yun ang Brazilian butt lift.
Now, in that case, yung nililipat yung fat sa behind, how long does that take? Is that forever?
Yeah, nag-ano yan, so far naman so good. Mga patients ko, nabubuhay naman yung fats.
Ah,
Oo.
okay.
Because that's the ano eh, that's the benefit of uh, getting your own fats and harvesting it to your autologous transplant at tawag yung fat transplant. Talaga nabubuhay kasi taba mo yan. Pag nilagay mo ang taba ng ibang tao, patay yun.
Okay.
Yeah.
Now, Doc, yung naman sa sinabi mo nga implant naman siya,
Uh,
when do you recommend pag-implant or kasi pag walang tab ang makuha?
yeah, pag walang makukunan.
Okay, yung ginagamit, is that silicone? Is it Gore-Tex? Ano ba
No, no,
to?
no. That's silicone gel. That's
Okay.
silicone gel.
It's not the same as yung pag sa breast.
Yeah, almost the same. They are the same. Kaya lang mas matibay yung sa puwet kasi inuupuan siya.
So hindi siya katulad sa breast na we know for a fact na nagli-leak. There's some cases na nagli-leak pa,
Right.
di ba?
Yes, yes. Kasi yung sa breast naman are malambot. Kasi when you touch the breast, di ba, dapat malambot.
Oo, tsaka gumagalaw.
Gumagalaw,
Yeah.
yes. So, the material, the envelope is different from the butt implant.
And when you do the butt implant, I know a lot of our clients, a lot of our listeners, yan ang pinakaano ng Global Pinoy. Yung sa butt. Alam ko
Ano?
itatanong nila, pakitanong, kaano katagal pag-implant? Kaano katagal ba ang recovery?
Oo, pag implant, mga 2 weeks ang recovery niyan.
So, pero pwede na siyang umupo o kailan sa side view?
Pwede umupo right after. Pwede umupo yan. Oo. Basta, binibigyan lang namin ng patients ng what do you call this? A girdle or something to wear on to support the butt implants, the behind.
So may girdle din yan.
May
Kasi,
girdle din yan. Yeah. May garment din yan. We call it garment.
oh, okay. Now, Doc, doon naman sa fat transfer from, say, what fatty place of your body, kaano
Oo.
rin ang downtime nun?
Yun naman, mas lesser ang downtime nun kasi wala tayong surgery halos. So, kasi double yun eh, parang papayat ka na and then lalaka pa yung buhat mo. So, kukunin pa natin lahat ng fats mo sa tiyan, so sexy ka. Tapos ilalagay mo lahat doon sa puwet niya, di ba? Double, double purpose.
Yeah, pero true ba yun na sometimes yung fat din pwede raw injection sa lips?
Pwede rin, yes. Hindi
Kaya
sa
nga 'di
tiyan,
ba ang
pwede
ang
rin.
joke nyo parang kinis mo yung sarili mong puwet.
Hindi, pwede rin yan lagay dito sa cheeks.
Para magkaroon ng
Yan.
laman.
Pwede rin dito sa laugh line.
Oo.
Any augmentation procedure. Pwede rin. Pero, yun lang mas sa other parts, mas mabilis mawala.
Ah,
Kahit na on fats mo. Rather than sa breast or sa buttocks.
okay. Now, eto ang for another one that we're gonna show. Alam ko, ang dami nagtatanong nito sa akin. Yung parang paano to pwede, at this, we need to concentrate on this one kasi yung nakita natin, majority nun, hindi naman para lahat for the girls. Ito talaga ang dear and close to everybody's heart, especially for the men. This procedure. Because
Ayan.
as we all know, as we age, nandiyan na yung
Andyan na.
thinning of the hairline
Andyan na as
or
we
sometimes
age.
hereditary. Dito,
Yeah, as
Doc,
we
ang ano
age,
nila
andyan na
dito,
yan.
yung parang transplant or the easiest
Hair
way to do it.
transplant.
So,
Hair
this one,
transplant.
ano pong ginawa? Kasi this one, it says here, February 2019, and tapos the following year, ayan na siya.
Yes.
So,
Alam mo,
ano?
ang ginagawa natin dyan is kinukuha dito sa likod.
Okay.
And then, very tedious yan. Para ka nagtatanim ng palay.
Okay.
Iwahiwalay mo yung buhok na yan. Itatanim mo talaga dyan. Parang ano, nag-ano ka ng palay. And then
Oo.
that palay will grow.
Okay, the growth is like how many months? A year?
No, you would see it mga 3 to 6 months.
Okay, pero hindi mo siya pwedeng shampoohin.
No, you have to you have to do your routine shampooing.
O pero kung para ka nagtatanim, does it hurt?
May anesthesia naman 'yun during
Okay.
the procedure. And then medyo sedated ang patient para kasi we do it for about mga 6 hours eh.
Oo, very tedious kasi kung nagtatanim ka.
Yeah, oo. Kumbaga 'di ba kahit sa farm naman inaabot ng 6
Wala naman tugtog na magtanim, di biro.
Wala na.
Teka, Dok, pag tanim na kaya, alam ko, naku, marami akong candidate for that. As a practice, isa nga, nasa Philippines kayo, tinatanong kung pwedeng ganyan eh. Kakalbuhin ba siya to do this?
No. No. No, kukuha lang dito ng portion.
So, hindi siya
Tapos,
kakalbuhin.
hindi siya kakalbuhin. Kukuha ng portion dito, tapos tatahiin yon.
Oo.
Tapos yon yung kukunin na part na yan yung kukunan yun ang donor.
Oh, okay. Wow.
Yun ang
Now,
donor.
especially now, yung mga uuwi o naandyan na sa listeners natin na naandyan or viewers. So, ano to? Do they need to get a consult first?
Yeah, of course. I need to see the extent. I need to see the extent of the baldness. Kung nasa harap ba yan, kung nandito sa likod, and then kung may makukunan ba ako sa likod, yung mga ganon.
Okay, now, most of these balikbayan, especially here, they only would have 2 to 3 weeks in the Philippines. Would that be a problem?
That's okay. Sabi ko sa iyo, the maximum is 2 weeks.
2 weeks from
2
the
weeks talaga.
procedure up to the downtime.
Yes. For the eye bags, it can be 10 days. Basta 2 weeks talaga. For the upper
So,
eyelid and the
kailangan
lower
2 weeks.
eyelid, the cleft, the facelift, 2 weeks talaga.
Okay, now, so what do you suggest? If they're flying to Manila, pwedeng magpa-consult na through online, right?
Through online, they just go to our website, yung www.mannyandpicalayanclinic.com.
Yeah.
Then you can book an appointment there, and then somebody will get in touch with them, and then they will book them to me or to Doc Pai for any kung anong concern nila.
Well, now, Doc, a lot of times kasi like what you said earlier, may pila. Paano to? Paano kung ano? Will you give priorities, especially if they're traveling, like for a month in the
No,
Philippines?
nasanay na kasi ako, Josh, sa siksikan.
Yes, I've been to your clinic. Yes, talagang nakapila. Nakapila
No,
talaga.
sanay, yeah, sa mga procedures, sanay naman ako na 3 to 4 times a day. Lalo na yung mga balikbayan natin, especially. Kaya ngayon, I have to go home na on the 20th kasi 21st, start na ako ng trabaho. Sabi ko, teka muna, jet lag pa ako niyan.
Jet lag pa.
Jet lag pa ako niyan. Tagal ko dito 3 weeks. Diyos ko siguro. Pero no, I can do it. Parang nasanay na rin ako eh.
Yeah, well, that's great. Now, yung hindi natin naman pakita eh. So you're still doing a lot of breast.
Everything, Josh. I do breast, I do butts. Uh, we have also vaginal repair.
Yes, I heard about that.
Yeah.
The
My OB sisters do it. And then ayun, under lahat ng pagpapaganda, all of the lasers, the Ultera, the may mas living machines pa tayo. We have the surgical and the non-surgical, lahat whitening. Basta visit
the
there,
drip. No,
yeah,
question ko, yung sa drip, kasi may mga two factors two school of thought. Yung drip daw, hindi daw siya effective, mas maganda raw yung push. Push po yung from syringe diretso na sa vein.
yes,
Yung namang drip daw, minsan, kasi usong-uso ngayon yan, especially a lot of balikbayans will come back here and they say, Josh, pag namin nakausap ka, sila Doc Manny, ganyan, tanong mo naman, kasi minsan may saline solution lang daw yon. Minsan, baka ang dami, it's right, sa mga malls daw, usong-uso yung mga drip bar or something. Now, ano yung
drip
comment mo
station.
dyan? Mas maganda ba yung push? Kasi two school of thoughts na kailangan talaga push yan kasi may vitamins. Pero iba naman parang an hour sila sa isang bar na parang drip bar somewhere. Even
Uh,
even Slimmers World are offering that. So medyo nagtatanong
yeah,
sa akin. Sabi ko, sige, tama-tama na dito si Doc Manny. I will pick his brain on that one.
yeah, ganito lang yan, Josh. Ang sagot dyan is, they are all the same.
Ah, okay.
They have all the same effects. Ang gusto lang ng iba kasi, nagmamadali sila. Halimbawa, takas lang sa office.
Yes.
Okay, tapos IV push yon.
Yes.
Okay, pag sinabi nilang, okay, I'm after the work na so I can relax. Parang relaxation time nila yon.
Ah,
Pero the drip and the push, they have the same ingredient.
yeah.
Yeah,
Now, yung iba kasi may mga pangalan, Cinderella, may mga kung ano-anong mga ano.
Snow
Can you
White.
tell me then, I think it depends on the labeling lang kung ano yung nakaandon. Depende sa
Yes,
vitamins.
yes. The important thing is the glutathione itself.
Yeah.
Kung ano yung ginagamit mo.
Okay. Okay, now that you mentioned glutathione, another question that I know it's dear to everybody's heart. Glutathione, they said it's bad kasi it affects liver or something. Ano ba yung talagang school of thought based on your knowledge as a cosmetic surgeon?
Yeah,
Kasi
bakit
sabi nila,
magiging
effect no nakakaputi. Pero talagang
oo.
that was really for people who had cancer. Ano ba talaga? Coming from the
Ah,
expert yet yourself.
alam mo yan, Josh, glutathione is also is also produced by our body.
Yes.
Glutathione is good for the liver, for the organ system, and for as an antioxidant,
Yeah.
no? Talaga ang liver, ang glutathione is given to mga cancer patients.
Yes.
Okay, that is to give them more to prolong life, ganyan. And because it it protects the organ system natin. So ang yung whitening is just a side effect
Correct.
of the glutathione. So ayan, syempre alam mo naman nagkausuhan na, nagkaglutahan na diyan. Talagang totoo naman. I use it myself weekly.
Yeah, so ano po 'yon? Yung next question, how often should you have the drip or the glutathione? Whether it's push or drip. Weekly ba yan? Twice a week? O twice a month?
Yes.
Araw-araw ba? O once a month? Once every 6 months? What is the prescribe? What is
Ano yan,
the best way?
binibigay yan twice a week.
Twice a week talaga. Regardless kahit
Twice a
maputi
week.
ka na.
No, makikita mo naman ang result niya mga 2 to 3 months eh.
So pag ano talaga, so that's the
And
kasi it comes with vitamins naman, 'di ba? Vitamin C.
vitamin C, it comes with vitamin C, it comes with placenta. And then, yun lang, you have to follow the instruction. Huwag ka magpapaaraw naman.
Yeah.
Kasi once na nagpapagluta ka naman, nagpapaaraw ka naman, wala din.
Yeah, kasi nga Siyempre, the
Wala din,
ingredient.
you're contradicting the objective.
Yeah. Now, you mentioned Ultera earlier. That's another craze here in America. One for one, it's very expensive. It's between this is what I heard and what I know. It is between 2,500 one session, and then I heard and I've seen personally 3,000 to 3,500, and they said one Ultera is good because it kind of tighten your skin.
Mm-mm,
Secondly, it
mm-mm.
promotes collagen, and
Mm-mm.
thirdly, parang once every year lang siya. How and then
Right,
the effect that was 3 years, 3 to 4 years.
right.
How true are those? Are those myth or are those facts? At
Yung
bakit siya mahal?
kasi ang Ultera is high frequency HIFU ang tawag nila diyan.
Hmm.
High frequency therapy.
Yes.
Pero the real Ultera is the Ultherapy, yung may R.
Yeah.
Sila talaga yung by Merz Company. Sila talaga yung nag-pioneer ng Ultera, which is yung sa Philippines, bilang lang yung kung ilan kami meron. That is very good. I do that.
Yung
Kaya hindi
Ultera.
naglulusen ang skin ko because of that. Because it stimulates the collagen. It targets up to the muscle para matak yung muscle mo. And then, yun nga lang, medyo parang mafe-feel mo parang karayom na tumutusok.
Mhm.
Yes, it's expensive because the transducer is expensive.
Now, Doc, yung effect naman niya, you see that what? Gradually ba yan? Kasi sabi nila once every year lang yan dapat.
Yes, gradual siya. Within
Mm.
3 months mo makikita yung procedure. And normally I do that in conjunction with threading.
Mm.
With threading para mabilis yung collagen synthesis niya.
Para mabilis. Now, among these procedures now, uh, meron bang bago, latest? Let's talk about latest on the field of cosmetics. Yung mga before we go to mga treatment, not for the treatment first, and then we'll talk about naman yung mga lotion na yan. Kasi ang dami talaga, yan ang dear to every Filipino's heart or even
Yes.
non-Filipinos as well. So
Yes.
any latest development, of course, the Ultera is something new, parang few years pa lang yan eh. Tapos of course, the threading is new. Any new development na talagang, kasi we're fascinated, not only Filipino culture, but I think globally, everybody wants to, the fountain of youth, and we want not to age, we want to age gracefully, and we want to
Right.
stop the hands of time.
Yes. Tama,
There's this
tama.
fascination and obsession, really. So, may
Yes.
mga development pa ba po, especially in your clinic?
Yeah, meron nga tayong mga bagong lasers ngayon to tighten the loose arms. Meron tayong mga lasers na for skin rejuvenation without pain. We have different kinds of facials talaga. Talagang we still have to update and update and update.
So, now, what about, which is dear to all the men too, especially some women, yung sa belly, di ba? Kasi may nakita kami dito na ina-advertise all over the place lately, yung para siyang equipment, ilalagay siya sa may abdominal part mo, and they said para kang nag-sit up ng 50,000 repeats. Is that something na totoo? Kasi meron pang nakita ko sa market, which sabi ko, investigate on that. I mean, you could buy it online, pero parang too good to be true. And I've seen some clinics here that they have this machine. They will tie the client do sa mid part, tapos nakahiga lang, and parang na-exercise daw yung muscle. So, on your experience and your expertise, is that something common in the market, or it's another one of those that may be questionable?
For me, those are questionable eh.
Yeah.
Like the cryo freeze, yung mga
Yes!
natin
Yeah,
ganon.
kasi may kaibigan ko nag-cryo freeze, walang nangyari.
Yes, because it temporarily freezes the fats
Yeah.
and then it shrinks the fats, di ba?
Yeah.
And then, pag wala na yung effect ni cryo-freeze, andyan na naman sila, magbaballoon out na naman sila. So
So,
parang it's a temporary thing. Alam mo, may meron kang wedding bukas, magpa-cryo-freeze ka today,
para magkasya ka.
para magkasya ka lang bukas.
Now, buti you said that kasi yung kaibigan ko diyan na alam ko nanonood. Ay, nako, kasi nagsabi niya, Josh, I had a cryo freeze, yung pinifreeze yung fats mo. Tapos
Yes, but
parang
that's
wala ka,
temporary.
I saw it, we saw each other like a month after. It's like, parang wala namang choice, parang wala namang change.
Alam mo, ang number one pa rin dyan is the Vaser lipo.
Yeah.
Yan, yung vibe, what I use in Manila is yun, top of the line na no downtime halos. And then talagang makikita mo yung shape, mauubos, walang bumps, walang lumps, mga ganun. It's a vibration assisted sound energy resonance.
Yeah.
So yun ang ginagamit ko sa Manila for a 360-degree liposuction.
Okay, now here there's another one. Maybe it's just a name. They call it tika lipo. Have you heard of that? Yung parang habang nilalipo ka, natatawa-tawa ka kasi nga parang hindi siya masakit. Yan ang uso ngayon. Parang we do tika lipo. So, ano yung tika lipo? Tinitikal, yung parang nakakatawa daw. Maybe it's just a name. Maybe it's a brand.
No. It's a name lang. Siguro ano 'yan, siguro small part ng ng body na sinaction, nagising siya. So kasi once na nilalagay mo yung anesthesia, medyo nakakakiliti 'yun eh.
So pinaname na lang nilang tika lipo.
I-name lang nila noon, oo, hindi yan general liposuction eh. Siguro ano lang yan, local. Kaya tinawag nilang tickle, nakikiliti lang sila. Then gising sila.
See, nga, ang dami ko alam kasi ang mga subscribers namin at saka mga viewers, they would send me. Tapos they have there's here, it's just a name, PRP. Parang pure platelet na kinukuha sa dugo mo.
Yeah,
Tapos
that's
sinasaksak
okay.
ulit
That's
sa mukha
PRP
mo.
is okay. Oo. Need to do that. Yung mga plasma protein.
So is that good? Kasi yun ang uso rin ngayon. Meaning, they'll do yung inaano yung mukha nila, parang
Yeah,
inaano mo.
ini-inject ka ng PRP. Oo.
Oo.
That's also good. That's also good. Oo.
And the Calayan Clinic does that too.
Yeah, we do that also. Oo.
So anong procedure na hindi kayang gawin ng Payan Calayan Clinic? Is there such thing na pag pumunta isang kliyente, sabi, ay, we don't do that. Kasi may mga clinic na ganon.
Ang hindi lang namin ginagawa yung masyadong imposible.
Gusto na niya miracle worker na.
Miracle, gusto niya talagang magician na ako. Sabi ko, ay, hindi talaga ako magician. Sorry. I-enhance lang kita.
What about tummy tuck? Kasi di ba pag nag-lose
Yes,
weight
I do
machine,
that. I do that. Tummy tuck, arm tuck, thigh tuck. We all do that.
oh my God. Oh my
Mm-mm.
gosh. Okay, now, yung mga procedure na yan, let's go with your social media where they can follow you. Okay,
Yeah.
Facebook
Ah,
muna tayo, Doc. Doc Money.
uh, ang Facebook, ang official Facebook ng clinic is Manny and Pai Calayan Clinic.
Manny
Okay?
and Pai Calayan Clinic. Yan sa
Oo.
Facebook.
Manny and
Meron na
Pai
ba po
Calayan
yung
Clinic.
checkmark? Wala pa.
Meron na.
Meron na
Meron
yung
na yata.
blue
Verified
checkmark
na
which is
yata yan.
verified.
Manny and Pai Calayan Clinic Facebook. What call this? Instagram.
Instagram.
Manny and Pai Calayan Clinic din. And what you call this? TikTok.
Aha.
Meron din. And Twitter.
Twitter. Which
Ano
is
yung
X
X?
na.
Ano yung X?
Twitter. Yung X na.
Yun. Meron din doon.
And it's
That's for
all
the
Manny
clinic.
and Pai Calayan
Manny and Pai Calayan Clinic. Dapat may clinic.
Clinic.
Ah.
Okay. Now, Doc, pag naman yung vlog mo, saan ka naman nila ipo-follow?
Yung akin namang personal social media, Doc Manny Calayan lang.
Okay.
Oo.
Hindi pa rin siya verified.
Hindi ko yung TikTok ata is yung ano yata, yung Instagram is verified.
Okay. Now, pero aside from yung Manny and Pai Calayan Clinic, yun yung official, meaning sa business. Pero yung
Business,
sa personal mo, Doc Manny
Oo.
Calayan.
Yung sa YouTube ko naman, Doc Manny TV.
TV. Oh, 'di ba? With
Oo.
technology, sana may network.
Tapos
So,
sa
yun ang
Instagram,
personal
Doc
mo.
Manny Calayan. Sa Instagram, sa Facebook, Doc Manny Calayan. Sa Instagram, verified Doc Manny Calayan.
So if a client who's listening to us and watching us right now, the best way to contact you is to your personal or to the official clinics? Na-filter nyo ba po
It
yun?
can be both. They can contact us both in both ways.
Oh yeah, you heard it. You heard it from the source himself. You could contact any
Yes.
time because a lot of you and people, and I know some good friends that already went to Dr. Manny Calayan, and to this day so ecstatically happy, and the procedure was done like 5 years ago. Parang may ginawa ka na. Not to mention another doctor's name.
Right.
Correct ni Dr. Manny Calayan. Parang nag-fail yung sa arms. Parang pinaliit yung arms pero hindi maganda yung pagkagawa. Parang naging ano siya, more of loose skin. So,
Oh,
and this is a personal experience of mine. So, and of course, I know Doc Manny Calayan way back. So sabi ko, why not? And so happened to be in Manila for 3 months. So I told this good friend of mine, go to Dr. Manny Calayan and ask for a consult. Lo and behold, this person did that, and ecstatically happy na talagang naibalik, at yung to this day hindi malaki yung braso niya. To this day talagang
maintained.
maliit. Yeah, parang
Yeah.
ginawa niya, well, of course, kinorek ni Doc Manny. And I will not mention the clinic, I will not mention the doctor who did the procedure, for obvious reason. Protect na lang natin.
Yeah.
Basta all I could tell you is this is personal experience ko with the good doctor na it was corrected with the Calayan Surgery Center at that time pa. And to this day,
Yeah.
we're still good friends, and sabi niya, ang ganda pa rin ng arms niya. Hindi, of course, hindi naman siya nag-diet na rin, pero ang ganda ng pagkagawa. Parang totong-toto naging slim yung kanyang
Yeah. As
sa
long as
babae kasi mabilis lumawlaw yung dito side eh. Yun ang naayos talaga. And of course,
as long as na-maintain nila yung diet nila, health, yung healthy lifestyle, it will ano talaga, it will be there forever.
yeah, and then one of the thing that I'm so proud, and I could tell you guys, and I could vouch for that, bihira akong makarinig ng complaint na hindi maganda yung pagkagawa o hindi sila happy. I always hear it from other clinics, and let's not mention those clinics. Pero I have yet, okay, and this is with all honesty, I have yet to hear na ginawa ito ni Dr. Kalayan pero palpak. I have yet to hear, and if there's anybody that would say that, I would like to know, because ang tagal ko na sa industriya sa TV, at the same time ngayon sa radio for the past 3 years. I have yet to hear a complaint. I hear complaints for other clinic na kasi a lot of times hindi daw yung doktor ang gumagawa. It's another
Yeah.
doctor and it's just a name. Pero sa ito yung alam ko kay Doc Manny Calayan, siya talaga. Unless,
Right.
parang, kasi
Right.
ang hirap naman, no? Sabi ka, hindi, yung isa nga sabi, of course, sabi, yun ang gagawa, pero pagdating doon, wala na, iba na yung gumawa.
Yeah, yeah, yeah,
Hindi
yeah.
naman pwede palang gumawa. Kasi nga,
Yeah, yeah, yeah.
hindi naman authorized. Ano yung take mo dyan, Doc? Ano ba yan? Di ba dapat full disclosure na pag, kunyari, ibang doktor ang gagawa, dapat sinasabi, hindi yung nakahiga na doon sa operating table, doon na
Oo.
lang.
Oo. That's for me that's unethical. Pero I cannot comment on that. Basta ako ako hands-on ako, and then pag ako maalis, I have a reliever. Isang reliever lang ako kasi pag marami masisira ka. Isa lang ang mentor ko, isa lang ang associate ko, isa lang. So pag nagkamali siya, sagot ko yun. Pero magaling eh. So wala din.
Okay, tapos Doc, yung mga ganon, kasi I know for a fact na marami ka nang nagawa ng iba, kinokorek mo.
Yeah.
What's your take on that? Di ba parang double gastos na yan sa kanila, di ba?
Yeah, kasi hindi ko naman masyadong pag ganun binibigyan ko ng discount,
Yeah.
and at the same time I have to do it. Yun ang Hippocratic Oath namin to help patients, di ba?
Yeah.
To make them happy. Kaya nga nandyan, to enhance them and make them beautiful and feel beautiful Tapos sisirain naman ng iba. So, what's your part? You're a repairman. You're a repairman. Lalo na yung mga nagpapa-inject sa ilong ng mga silicone oil na hindi naman doktor ang gumagawa. Nako po.
Yeah,
So,
especially let's be blunt about that kasi I mean you guys could check it on the YouTube yung mga people especially Filipino men nagpapa-inject sila ng mga para humaba yung kanilang ari and then we have heard na ang ini-inject nila kasi
petroleum.
may mga sa kanto nag-i-inject daw ng oil, the miracle oil they'll call it, only to find out maganda lang sa umpisa, tapos after a while, nabubulok, yung
Wala.
petroleum ang ginamit.
Yes. Lalo na yung sa mga puwet, Josh. Sa puwet
Yeah.
at sa breast. Nagbubukol-bukol yung breast, tapos nabubulok. And then sa puwet naman, nabubutas yung puwet.
At saka sa ilong. We've seen that
Sa
sa
ilong. Yes.
Now, yung doc, yung ganyan, yung mga nag-try, is that something na masasak pa ba yun? Maha-harvest mo pa yun and change it? Can you still correct
Depende.
those?
Depende. Pagka masyado matagal na, 20 years, 15 years, yeah, you can remove some of it, but not, yung iba kasi namumula na yan
Yes.
So, ibig sabihin, nasa skin na yon gusto nang lumabas. Yung with the colorness, with the color of that, hindi mo na matatanggal yun.
Mm-mm.
Mm.
In your practice though, what was the hardest? I mean, among the procedures have you done, what was the hardest? Yung parang
Yun. Yung mga injected part. Yung mga injected na papalitan mo ng implant. Tulad sa breast, may mga bukol-bukol na. Yung iba, ang tigas-tigas na ng breast.
yeah.
So, you have to remove the yung mga nagbilog-bilog na tumigas, and then depende. Sinasabi ko minsan sa patients, we cannot put implants yet kasi we have to pagalingin muna natin yung breast. Ganun din sa puwet. Kasi pag nilagay mo agad yung implant, magre-react sila. So we have to wait for 3 months, 3 to 4 months, ganun. And same with the nose.
Mm-hmm.
Iba pag talagang sirang-sira na yung nose, gawa ng oil, hindi ko muna nilalagyan. Ina-observe ko muna for 3 months.
Yung mga ganun, Doc Manny, yung mga ganyang cases, may mga nare-reject ka rin? Like you said, pag talagang hindi na pwede, talagang there's nothing you could do.
Yeah.
Ano yung
Oo,
solusyon
oo.
nun? Wala, mawawala na yung ilong nila, wala na yung breast nila.
Yes, we have the right to refuse naman. So pagka talagang malabong-malabo na, sabi ko, wala. You have to go to the doctor who did you.
No? Now, yung ganyan, kunyari, may clinic na pumalpak, are you obligated or is that something, kasi dito parang, I'll use lang example, pag lawyer, nag-change ka ng lawyer, kunyari sa migration, you are allowed to get them the records, yung case. In your case, kunyari, nagpagawa sila sa ibang clinic, tapos tabing yung ilong, hindi na ayaw nilang bumalik doon kasi they lost the vote of confidence. So they take the case to you. Is that something na papaalam mo dun sa doctor? Is that the way to do it or you start from scratch?
Basically, ang ginagawa ko na lang, ina-analyze ko na lang Based on on the, based on the report of the patient.
Yeah.
So, based on that report, ayun, ano ko na lang, ginagawa ko na lang yung magagawa ko.
So it's not necessarily you'll get the medical records on what was done. And
No
is
more na. Kasi usually, ang mga ganyan, wala naman medical record yan
tapos you're not obligated to call that particular and say, hey, so and so, especially just like in our field, maliit lang yung community, kala nila laki-laki ng media. We talk to each other. Is that something that you guys say, hey, Dr. XYZ, pumalpak ka doon sa ilong ni Chuchu?
Ay, hindi.
Walang ganon.
Wala.
Walang ganon.
Kasi
Respect na lang.
unethical yung ganun Ethics lang.
Talaga, hindi mo pwede
Oo.
sabihin na,
Ethics lang.
ano ba?
Though sinasabi ng patients, tinatanong ko yung patients, who did that? Si doctor ganyan. Si ganyan. Okay.
So
Hindi ko
wala kang scoreboard.
wala. Parang meron. meron sa utak. Kumbaga, alam mo, sabihin nila, sabihin ko, ay, siya na naman. Oh, alam ko na. What's the problem, di ba?
Nako, we should really talk offline. Ang dami siguro nating kilala at kilala mo, kilala ko.
Yes, yes, yes. Oh my God.
Now, yung sa competition naman, it seems like you're not very into the competition eh. Sabi mo nga sa akin a long time ago, your business card is your work. And
Yes.
that was so appealing kasi 'di ba, yung iba kasi they hire endorser, yung mga actors and actresses nagko-crossover yan eh. Yung ikaw kasi uh, they tend to tell the audience, their fans, their supporters, simply because you did a good job and you maintain that. And one
Mm-mm.
of that is, of course, the king of talk, Boy Abunda. Siya pa rin ba? Sa'yo pa rin ba si Boy
Of
Abunda?
course. Diyos ko si
Yeah.
Boy pa. Napaka-loyal nun. Boy is so loyal. Once you know Boy and once Boy loved you, he will love you the rest of his life.
And he's not aging at all.
Yes, Diyos ko.
Yeah.
Napaka-banidoso na si Boy. Diyos ko po.
Kasi yung last na napanood ko sa kanya, nagpa-ultera siya kay Dr. Pai.
Yeah, oo,
That was
yeah.
so funny. That's so funny. And of course, another person na laging uh, uh, parang habitual sa pupunta is si Mega. Si Mega, not Mega Sharon. Si Mega ng GMA.
Ay, Diyos ko, grabe rin yun. And yun, recently, si Pokwang.
Yeah.
Pokwang, hawak
Yes, si
na rin
Pokemon.
natin.
Yes.
Sila Pokwang, si Ate Guy, ano ba? Si Nora Honor, sila. Marami.
Yeah,
Marami.
Nora Honor was really a revelation kasi of course you know
Yeah.
naman the legions of fans of the national artist, the superstar Nora Honor.
Yes. Sabi ko,
Tapos
Ate Guy, you're a national artist. You should be an example of
yeah,
beauty. And
nag-iba nga yung itsura niya. I mean, of course, I know you're still in the process, but makita mo talaga bumabata, 'di ba? Yung parang nakikita mo and
yeah, oo. Ano lang yan, lasers pa lang si Ate Guy. Wala
yeah,
pang knife dyan.
yeah, kasi grabe. Nakita mo
Takot siya.
yung
Oo.
progression, 'di ba?
Yeah, yeah, yeah.
Yeah,
Oo.
that's so exciting, and I know, of course, not to mention the other artists and some of your people that have been vouching, and I'm
Right.
so glad. I'm so glad that sabi nga nila, when you're in Manila, who do you go to? Sabi ko, isa lang doktor kilala ko, Dr. Manny Calayan. Eh. I mean, nobody touches my face or anything. Doc Manila. Sabi niya, so when was the last time you seen? Well, I've not seen him for the longest time kasi when I go to Manila, I'm always busy with other things. Sabi ko, I think that's the time not to visit him. And luckily, when I turn on my Facebook, oh my God, Dr. Manny Calayan is here. So, now you mentioned earlier in passing that merong bahay na pinapagawa para sa'yo. So,
Oo.
what does that mean? Ano yan? Sige, i-put kita on the spot. What does it mean? Dito ka na ba titira? You
No.
can...
Sabi ko kasi, gusto ko mag-semi-retire early. Sabi
Ha?
ko. Bata pa ako, 'di ba? So
Yeah,
wala lang yung sister ko naman mag-isa lang with his son.
yeah,
Ang laki-laki ng bahay. So sabi niya, "O sige, pagawan kita ng sarili mong unit dito sa garden ko din. Ah, para pag andito ka, dito ka magsi-stay or kung sino mang isama yung mga anak mo, ganyan." Sabi ko, "Oh, kasi gusto kong pag mag-US ako, tatagal ako."
oh my God, seriously? That would be nice.
Yeah.
But
Tatagal ako
no
kasi.
plans of like in the past you did a clinic here. You don't want to do that.
No, my sisters have plans of
Mm.
having a med spa.
Oh yeah, kasi that would be nice. Kasi let's face it, your name is already a byword.
Yes, kasi my sister is a psychiatrist.
Yeah,
So, she has doctors na rin eh. He's established na dito sa LA.
yeah.
So, parang she's diverting into aesthetics.
Good.
Yeah, and then my daughter, si Hannah, is an esthetician.
Yeah,
Pero based on Vancouver. So, she's
yeah.
planning to migrate here and have the med spa.
Oh, and how about Bernice?
Bernice wala, Manila based yun.
Ay, ayaw niya talaga.
Ayaw niya talaga. Kasi andun yung fiancé, andun yung husband niya.
Oh, and so most likely Bernice will inherit the business.
Yeah, Bernice and the youngest,
Ah, talaga? Sila talaga? So
Andrea.
si Hana lang talaga andito na.
Yan na lang talaga andito.
I think that's a funny thing about it kasi when I got to meet you, ang babata pa ng mga ano
Ay,
dito pa
nako,
tayo sa
mga
Beverly
chikiting pa
Hills.
yun. Diyos ko. Ibig
'Di ba
sabihin,
ang
ganun
tagal na
katagal na,
nun?
Josh.
Yeah, ang tagal na tapos ang babata pa nila Bernice, nila Hana, tapos
Yes, yes.
Si Hana pa yung naglalagay ng yellow sa mukha ko.
I
Tapos of course
remember
I
that.
followed naman yun, 'di ba? Nag-graduate
Oo,
na
I remember
si
that.
Hana, nag-graduate na si Bernice. Tapos sabi ko,
Yes.
doktor na, sabi ko, grabe, times fast, it flies.
Time flies so fast.
But I'm glad
Grabe.
that you're doing that, the semi-retirement, because I think it's passing rite of passage for the kids. And we always talk about that. We always talk about that na
Yeah,
eventually the kids
yeah,
will take over. Sabi ko,
yeah.
magdo-doktor ba sila? And you said, yeah. Oh,
Yeah, di ba sabi ko sa'yo, dapat. Di ba?
dapat. Kasi sayang naman yung pinaghirapan mo at saka ni
Yeah,
Dr.
sayang
Pai,
naman
di
yung
ba?
legacy namin. Di ba? Sayang naman yung name na ginawa namin.
So,
O, di,
as far as you, ano, ganyan na lang ba? Starting 2024, ano ka, a little work, then you travel, a little work, you travel.
sana, pero parang hindi eh. Tulad nitong 3 weeks kung wala, pinagagalitan na ako ni Bernice eh. Sabi niya, Dad, ang dami na dito naghihintay sa'yo. Umuwi ka na. Sabi ko, Bernice, akala ko ba mag-semi-retire na ako? Hindi ko rin alam, pero hindi pa dapat. Uwi ka na. Ang dami dito naghihintay. Naku, patay.
Paano yun, Doc? Kasi alam ko, like, people go with you. Paano yun, di ba? Like, yan, they really want your personalized care.
They
Yung
have to wait.
gusto nila, ikaw yung gagawa. Ayaw nila
Uh,
iba. How do you convince them to try yung meron kang, sabi mo nga, meron kang,
oo, yeah, yeah, yeah. May mga pumapayag naman, I talk to them na this is the only associate I have
yeah,
for many years. If I go to abroad, this is the only associate I trust,
yeah.
who can I vouch for, na magaling din gumawa. And then, happy naman sila. Yeah, happy naman sila. Yung
So,
mga hindi makahintay, yung mga willing to wait, they wait for me.
yeah. Now,
Pero yung mga
syempre,
halimbawang balikbayan,
yeah.
halimbawa, umuwi, hindi alam na wala ako, pumapayag yun. Kasi
Ah,
their time is very limited. They went home just for the surgery.
and but you have people also that they rather wait for you. Kasi it's a
Yeah,
Calayan brand eh.
yeah, yeah. It's the Calayan signature eh.
Okay, one of the question that's dear to my heart, I bought boxes and boxes of Calayan soap.
Ah,
Nawala na siya sa Mercury Drug. Ang
oo.
ganda nun, ang ganda niya kasi meron siyang yung hindi siya flat, meron siyang parang pang massager na
Yeah,
rin.
micro scrubs.
Yes, what happened? Bakit na discontinue? Are you planning to go back to that?
My daughter si Bernice, may plan sila. May plan sila.
Yes, that was such a good soap. I swear to you.
Yes,
Ano,
oo.
binili ko karton na karton, tapos dinala ko rito sa Amerika. I
That
still
was
have one.
so,
Parang
yeah, that
remembrance ko
was
yun.
so mabenta. Grabe yun.
So, mabenta. Tapos yun, it's a black box. Tapos may kalayan na parang white thing. I still
Kalayan
have it.
Secrets. Kalayan Secrets.
Yeah,
Yeah.
ang ganda no.
Oo.
Tapos now, since we talk about that, meron bang plano na magkaroon ka ng kalayan line?
Meron yung anak ko. Yun nga sila Bernice. Talagang, si Bernice kasi iba ang ano niya, iba ang vision niya eh. Ang gusto niya is to expand, to have more machines. Ganun muna siya. And then, pagka establish na yung machines uli, papasukan niya yung brands.
Yeah, kasi parang the name is already a byword. The name already has
Yeah, oo
this
nga eh. It's
alam
a
mo na,
household
very
name.
effective, siya,
Mm.
very credible. Kaya nga nung naglabas ka ng Kalayan, parang nalaman ko lang yun when I went a couple of years ago. So, may
Yeah.
Kalayan. So, ha? So, panalo siya, especially for guys, right? Tas supply
Oo.
want supply, tas nawala. Tas sabi ko, sige, once I talk to you, I'll ask. Dapat i-revive yun kasi that is so
Yeah,
amazing.
that will come back. Don't worry.
Now, do sa mga lotions, so let's go to skincare. Okay? Ano lang, before we close. Yung skincare, kasi ngayon uso mga serum-serum. Ano ba talaga ang proper way of doing the skincare? Dapat ba serum? Okay, normally, what I know, and of course you could correct me, what I know is you do your cleansing, you cleanse your face, and then you do your toner, and then you anything, and then you do the serum, and then you do the moisturizer for guys, and for the ladies maybe almost the same or a little bit
Mm-mm.
different, and then you do your PF, regardless whether you're inside the house or you're going out. So is that the proper way you do the serum before the moisturizer? Because there's always a debate on that. You do the moisturizer before the serum. Which one, based on your expertise?
Ako ha, personally, what I do, I use the facial cleanser,
Yeah.
okay? And then after that, I use the toner,
Yes.
okay? And then I use the cream.
Ah, cream. Okay.
Cream, ang cream kasi when you massage it, it penetrates eh.
Okay.
Okay, you use the serum last.
Ah.
Kasi the serum penetrates at the same time tumitigas. That
Oh.
is to close the pores and to ano para mag-work yung serum sa face mo.
No, after the serum, ilalagay mo yung PF, sunscreen.
Right, 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 right.
Okay.
And ang ginagawa ko kasi pinapatuyo ko muna yung serum before I put the sunblock. That is during daytime, ha.
Yeah. About for nighttime.
At night time, you don't need to put sunblock.
Ah, okay. Kasi there's school of thought naman na kahit daw nasa bahay ka lang, na mag-sunblock ka. Parang hindi
Yeah,
naman. Nasa loob
in
ka
a
lang ng
way because
bahay.
of the lighting, pero that's very minimal. That's very
Oo.
minimal
Di
effect.
ba parang sayang lang. Now,
Yeah.
meron din yung cleanser, may dalawa rin food, dalawang school of thought to. Wag daw yung cleanser yung may mga beads kasi nakakagasgas daw ng skin.
No, no,
Kailangan
no.
lang yung
No,
foam.
no. It exfoliates eh.
So is that recommended or how many if it's recommended how
It
many times
doesn't
a week?
matter with or without. It doesn't matter with or without the scrubs.
Oh, okay. Kasi
Kasi iba naman yung scrubs na kasi nare-relax ka lang naman with the scrubs
oh,
eh.
yeah.
Parang feeling mo lililinis pa, 'di ba, more. Pero it has the same effect.
Right. Okay, pero you don't stick to one particular brand kasi one of the question too that I know was asked of me, especially the ladies, dapat daw ba yung mga ganyan iba-iba o you stick to one line? For example, iba yung moisturizer mo, iba yung serum mo, or it should be
Diyos
one
ko,
line, or does it really matter?
hindi mag-Manny and Pacquiao clinic, ano sila, line.
Meron na.
We have in Shopee.
Ah, okay.
We have in Shopee, Manny and Pacquiao line products.
Okay, and that what do you have for that product?
We have their mga serum, mga for acne, for whitening, SPF, for the roll-on. Everything, meron dun. Basta
No,
hanapin lang.
Shopee, pero wala sa Lazada.
Wala sa Lazada. Shopee lang ang,
Shopee. So, oh,
Shopee.
our viewers and especially the balikbayans, I think you could go buy Shopee when you or you could ask your relatives to buy it for you and send it to you.
Yes, yes.
Yeah.
We have
Kasi
in
wala kang
Shopee.
plano to distribute here in the States.
Wala pa, wala pa.
Wala pa. Pero in the works.
In the works, oo. Pero unahin namin ng Philippines.
Yes, kasi talaga,
Oo.
Doc Manny, I think, like what I said earlier, cosmetics or something to do with aesthetics is really the big business now. Especially
Right,
you have the right heart for that.
right.
So, nag-change ka ba ng tagline para sa Surgery Center? So, it's not Surgery Center naman. It's now Pai and Manny and Pai Calayan Clinics.
Yeah.
Wala nang Surgery Center. So, when I met you, it was still Surgery Center.
Ang tagline nila ngayon is parang love yourself.
Ah, that's nice. That's
Man and
nice.
Pike lang din, just love yourself. Parang you give time to yourself, di ba? You love yourself first Pamper yourself. Parang ganon.
Okay, I would love that. Dapat may mga
Yeah.
merch. Sabi mo kay Bernice, mag-merch na rin. Mga t-shirt, sweatshirt, cap. Hey,
Yeah.
that's the in thing now.
Yeah, ang ganda nga ng ano ang ganda ng thinking ng millennials. Iba ang thinking ng millennials talaga.
Yeah, and it's free advertising. People will wear the shirt, the
Right,
Lion shirt, and walk
right.
around BGC and take it home to their family
That's
in the
true.
States. And
That's
it's a
true.
promotion na hindi binili pa nila yun, ha?
Yeah, binili pa.
Now, now that you mentioned earlier, you did some treatment on your own. Is it okay for you to tell us, to share with us? Ikaw nagsimula niyan. I will just follow through. That will
Sure.
be our end.
Oo.
So, bakit ganyan pa rin? Parang hindi, parang the time froze since the last time I've seen you personally. Yan pa rin I mean, it's good. You look great. So, ano yun?
Sabi nga nila I look
You look
better than
younger.
before.
Huh? You look
I look
younger.
better than before daw. I look
Well,
better than before.
I'm being polite, but yes.
Well, aside from having a mustache,
Yeah,
having a beard, eto walang wrinkles because I do Botox, I do fillers, and I had my eyebrows microbladed.
yeah.
Okay? And then I had my fillers here para walang
Talaga
lubog.
wala kang ano, parang eye bag.
Yeah, walang lubog. And then I did the threads here and the fillers. I did threads here. I did threads on my nose. Oh, yeah, to augment it.
Yeah.
And then I did threads here also para walang double chin. And then I do Ulcera. I do Ulcera every Banidoso ako every 6 months.
Okay ba yun? Kasi some people said baka raw mag ano yung mga cells. So okay lang palang every
No,
6 months.
it's mahal lang. Kaya sinasabi lang. Sa akin naman yon pinagagawa ko na. Yeah,
Pero
I do mga lasers. And then, of course, I use my own products for mga skincare lines.
oh well, now I'm excited to call a friend to order that in Shopee. I didn't know that it's already only available in Shopee. I thought I have to go to your clinic either. So you have four clinics now. You have one in Cebu when it opens again. You
Yeah, to Davao.
I know it's the seaside SM Seaside ba
Yeah,
yun?
SMT side.
I told you I follow you SM Seaside,
Yeah,
and
yeah,
then you
yeah.
have, of course, you have the Makati office. You have
Yeah,
the Quezon
Alabang.
City. The Quezon City is in Trinoma.
Yeah, yeah, yeah.
Okay, and there's one more in Alabang.
Alabang. But the Trinoma is still closed, ha?
Yes. Okay, so what we're gonna do also, we're gonna, for our audience, we will have a card where all these places would be, and also the phone number. We'll print that on the screen. As a matter of fact, when we do this, it will be
Yeah.
posted.
Ah.
So para it will be easy for them. And as a matter of fact, we'll be showing it with the different numbers as well as the contact information and where they are. Now, any word for your, of course, for your fans, supporters, wala na bang mga TV guesting ka na magpa-perform ka?
I just played Family Feud with Ding Dong Dantes.
Yes, yeah, the number one game show in the country.
Yes, oo. Ayun, hello there to all my fans. Ever since
Yeah, I
ilang taon na,
know.
ilang taon na ba, Josh? Ang tagal-tagal na, no?
Tagal na. Especially duets talaga. Doon nag-start.
Yeah, yeah, yeah.
Yeah.
Thanks for being there all the time. Thanks for patronizing us. Thanks for believing in us. And then, yun, we're still here. And we will keep on serving you better and better every day. We make you look younger, more beautiful, and more charismatic.
That's a perfect world. Oh, last question from our audience.
Oh,
Jawline kasi a lot of Filipinos daw medyo bilugan ng mga muka. For a jawline, how do you suggest for a jawline for a person to have a jawline? Lalo na pag bilog yung
we
mukha
have
nila.
yeah, we have the Aptos thread
Yeah.
that to what do you call this? To tighten this, and we have the threads, the cog threads, for the V shape.
Yeah.
Yeah, you put it here, and then to make your face shaped like a V.
Yeah, yung hugas bigas. They call
Hugas
it hugas
bigas, they
bigas.
call it hugas bigas.
Oh
Yes,
my God. Well,
and
Dr.
yeah,
Aya, this is such wonderful, and I know it's taking so much of your time. It's almost an hour and 37 minutes. That is amazing. And I
ganun
know
ba
this
yun?
will be well watched by a lot of our global Pinoys kasi talagang that is
Parang ang bilis.
ang bilis. There's so much to talk about, and I think you covered most of the questions as well as and all I could tell you is of all the clinics I've been to the Philippines, it's always been Calayan, the Calayan group for me.
Yeah,
I could
thank you
vouch
so
for that,
much.
and uh,
Yeah,
it's just not only they're my friends, especially Doc Money. It's a go-to place, and I know I apologize. I have not been to the clinic, but I think starting hopefully next year, I will definitely see them. And you see, pag meron akong ginawa sa akin, live natin. Live, I promise you,
after yan.
live natin para makita nyo ang change. Sabi nga ni Dr. Kalayan kanina, I look better, I look younger. Baka mamaya maging sanggol na ako. So, Doc
Nak-
Manny, maraming maraming
Ano
salamat.
to yung virtual hug?
Ah,
Ganun ba?
virtual hug, that's right.
Virtual hug.
Before we close, we are always showing right now as we speak. We're showing the different places where you could go to any Kalayan clinics or Pi and Money and Pi Kalayan clinics. It's in different parts of the metropolis as well as in different parts of the country. We will also place a disclaimer that, like, for example, the trinoma is currently closed because of, they're still in the pandemic mode. It's just, and also the one in Cebu, but we will always announce as well once they're open para yung mga Cebuanos natin will not need,
Updated.
yeah, they don't need to fly to Manila to do that. But definitely you could visit the clinic which we're posting right now, and you could see that, and we will post it as I promised. And the trinoma is closed for now temporarily, as well as the seaside in SM in Cebu, but definitely the Makati office is open, as well as the Alabang office. And as we already know, he said he's going back. Tapos na yung kanyang maligayang araw dito sa Los Angeles, California. So he's gonna be back in Manila, and as early as a day after he arrived, then he's going back to work. And that is an exciting time, especially makakahabol pa para sa Pasko at the new you.
Yes.
Love yourself ang kanilang tagline, which is so amazing.
And then watch out then sabi mo kay Josh sa kanila na pagbalik ko next year baka may meds pa na kami dito
Yeah, so as mentioned, there will be a med spa that is in the
in
plans.
LA.
There will be
Yeah.
It will be in LA. It's a med spa, and we will announce that. And of course, I will guest him again. And if the med spa is already available, we'll do a site visit. We'll do an ocular, so you'll see it live as it happens. And
Yes, Josh will be the ribbon cutter.
I would love to, including all the officials of that city, whoever we could invite.
Right.
And of course, as promised, we will always do a press conference, because this particular doctor is not only the best of the best, like what I said earlier. He's the celebrity doctor of the stars, and of course, he's a bona fide cosmetic surgeon, but he's also a dear friend. It's making me look good, and that's all I could ask. So before I close the show, again, maraming salamat. You guys are wonderful. Continue sharing our shows. Continue watching the shows. And tomorrow, I'll see you tomorrow for Dear Kuya Josh. My other, it's 10 p.m. here in the Pacific, and in different parts of the world. It depends on where you are in your time zone. But in the Philippines, it's 2 p.m. on a Sunday. And as always, there'll be a new letter that we have to discuss, and it will be an exciting time. So for those people who will be watching this later, yung team replay natin and team share, maraming salamat po. At of course, I am lost of a word to extend my gratitude for all your support for making this show, my shows are really doing wonderfully. So maraming salamat po. At the same time, again, thank you, Doc Manny. It's a pleasure and it's a wonderful thing that to see each other again, although virtually, but definitely you will see my face in your clinic
I
soon.
have to.
Yeah, so before we close, I always tell people be kind. You can never go wrong with kindness, even though it's so hard. Be kind anyways, and you can never ever go with wrong with kindness and any act. And I am a believer of this, and it happened to me. Any act of kindness that you do to people, it is practically guaranteed it will come back to you in so many ways,
Tenfold.
different times, with different people. And with that, maraming salamat again, Doc Manny Calayan.
Thank you so much for being here. It's my pleasure.
Yeah, Pi and Manny and Pi Clinic, and we're showing it right now. And Doc Manny, anytime that you have anything, we could do Zoom, and I could go live when I visit Manila. And this is more to come now that we reconnect again. I'm so happy. This is such an exciting
Yes.
time. But watch out for more great news from the Manny and Pai Kalayan. Especially, I'm looking forward to all these lotions and all this skincare that it's being developed as we speak. And of
Yes.
course, for all those other lotions and cleansers and toners and serums, we just heard from the source himself. It's already available in Shopee. So yung mga balikbayan and your friends, family, and people in the Philippines, you could order it to Shopee. And I heard it's one of the best also for ordering, and it's really safe and it's really commendable. So with that, maraming salamat po. Good night, everybody, and enjoy whatever's left of the weekend. And if I don't see you tomorrow in my show, you have a wonderful time. God bless us all. Bye, everybody. See you next time.
Bye.